Bill C-368 has the potential to influence the future of the Canadian natural health industry, including your ability to access and sell natural health products. On April 29th, Bill C-368 began its second reading in the House of Commons, where MPs discussed the merit of this bill for 1 hour. As you'll see in a moment, this conversation went extremely well, with Conservative, NDP, and Bloc Québécois MPs all pledging their support for Bill C-368.
We need to move forward with this legislation, and the NDP will be supporting this legislation at second reading. We want to get this to committee.
And that's why we're going to vote in favor of C-368.
Given all that, I am very proud to stand and support the member from Red Deer-Lacombe's Bill C-368 to repeal specifically sections 500 to 504 of Bill C-47 and restore the status quo on natural health product regulations.
The Liberal Party, however, does not plan on supporting Bill C-368 at this time, despite the massive amount of correspondence they've received from their constituents.
The government will be opposing this bill. I must highlight the exceptional engagement from the community of Richmond Hill. Our office has received over 1,200 communications, including emails, petitions, phone calls, and pamphlets from constituents deeply concerned about the regulation and safety of NHPs.
Sometime this spring or fall, MPs will come together again for another 1-hour debate followed by a vote to determine if Bill C-368 will continue in the official process and be sent to the Standing Committee on Health for deeper consideration. Let's review some of the topics MPs discussed, starting with the impact of Health Canada's new regulations on freedom of choice and public health.
Since last spring, my office, like the member from Richmond Hill, has literally heard from thousands of people concerned about what the government is doing and the increase in red tape they are suggesting through these regulations. These new fees and regulations will mean fewer products at higher prices on their store shelves, potentially depriving consumers of the benefits they rely on for their health and well-being.
The impact on consumers that are using these vitamins, the probiotics, the homeopathic medicines, and finding it more difficult to access potentially these natural health products because of the actions of Health Canada and the actions of the government. As consumers, we have that ability to distinguish and to make sure that we're choosing products that are appropriate for us.
These stores provide valuable products that keep Canadians healthy, that improve our mental and physical well-being. The last thing we should be doing right now is attacking those very businesses that millions of Canadians rely upon, Madam Speaker.
This industry is $3 billion a year in Canada. This is how much Canadians rely on these products for their own health. And that's the prevention, the healthcare prevention that keeps people actually out of the hospital.
MP Blaine Calkins also raised concerns about the disproportionate impact these regulations will have on women.
You would think that this Prime Minister, being the self-professed feminist that he is, would have actually done a gender analysis on the impact of Bill C-47 when it comes to natural health products. But there was no gender-based analysis, and you might be surprised to know that over 80% of the consumers of natural health products in Canada are women. 90% of practitioners, so this is your homeopathic doctors and so on, 90% of practitioners are women. Well over 50% of the micro-businesses are female-owned in this particular industry, and 84% of direct-to-customer sellers are women.
Businesses are also expected to be dramatically affected by Health Canada's new regulations. Here's what some MPs had to say about this.
Right now, you may be interested to know that about 54,000 people in Canada are directly employed in the natural health product industry, and they figure about 66% of those jobs will be affected or negatively impact once the self-care framework is brought in.
There is no common sense in the approach this government is taking for natural health products. The changes made will reduce choice, increase costs for consumers, and drive businesses' investment in product development out of Canada.
The 2021 Auditor General report that Health Canada has been relying on to support their regulatory changes was also discussed by MPs. Here's what they had to say.
The Auditor General took the strange step of actually going and taking 75 products. Now, these weren't random products off the shelf in Canada. These were 75 products that were deemed problematic from the beginning.
When you look at the Auditor General's report, there was a small issue, in my view, that was pathological because rather than just looking at things randomly, we targeted products, locations, companies where we knew there were issues.
We strongly encourage you to stay engaged because the second reading process is not over, so continue sending letters and communicating with your Member of Parliament on this issue.
And we need to stop this. So for the Canadians that are out there, call your Liberal MP, call your NDP MP, call your Green Party MP. Tell them to change how they voted on C-47. Get them to vote in favor of Bill 368. Let's get this bill to committee. Let's have an actual proper consultation with the industry. And if there is something that needs to be changed, we can at least have an honest conversation and Canadians can be involved in a transparent way. Passing this bill through the back door, tucking it into a Budget Implementation Act is shoddy lawmaking, it's shoddy policy making, and it flies in the face of everything that we've done to this point. I encourage my colleagues, Madam Speaker, to vote in favor of Bill C-368. Thank you.